Hello, everyone, and welcome to SCube TV Global. I am your host, Rajni Bharara. Guys, today is 1st of December, and 1st of December is known for World AIDS Day. So, today on World AIDS Day, we have got a very special program for you. Today, we have with us a very successful surgeon, Dr. Joseph Samuel. With being a surgeon, Dr. Samuel has also been fighting with HIV for more than a decade. Today, on this special day, we are going to speak with Dr. Samuel about HIV and his experience during the treatment and fighting the disease. It is going to be a really special episode, so keep on watching. But before, we would like to welcome Dr. Joseph Samuel to SCube TV Global and thank him for taking out time and doing the show. Hello, Dr. Joseph. Welcome to SCube TV Global. Thank you so much for taking out time and doing the show.
Yes, thank you so much. I enjoy being with you now.
Thank you. Thank you so much, Doctor. So, Doctor, before I begin about, HIV or AIDS, like I mentioned that today's topic is going to be that and also your experience throughout that journey. So, before I ask you about that, I actually would like to know from you if you can please give your introduction to the audiences. I already have introduced you, but I also would like you to give your introduction to the audiences.
Thank you, Ms. Rajani. I am Joseph Samuel.
Mhm.
I'm from a town called Ongole in Andhra Pradesh.
Mhm.
And I did my undergraduation as well as post-graduation in general surgery in Christian Medical College, Vellore. And I'm not only a doctor, but a patient as well. By God's grace, I have been serving people living with AIDS over the last 2 decades. And as I mentioned, I had a professional accident during my surgical training in CMC Vellore in the year 1995. And thereafter, I was sent to United States for retraining in HIV/AIDS in 99. After returning from US after a short stint of 3 months, I have been working in this field
Mhm.
initially in the mission hospitals, thereafter in the secular world. I have been working here in Ongole for the last 14 years.
Mhm. Okay. So, Dr. Joseph, you actually have given your introduction as in what you do and how you became a doctor. And, with being a doctor, you also are a patient. Now, I actually, with this introduction, now I would like to know from you, if you can please talk about your journey with HIV. If you can please let our audiences know about it.
Yes. As I mentioned to you, I was infected in the year 1995,
Mm-hmm.
and I could complete my training in surgery. Thereafter, I went to a mission hospital, and one of my professors, Dr. O.C. Abraham from CMC Vellore, he organized a visit for me to the United States in the year 1999. Of course, his intention was that I would settle down in the United States and 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 be comfortable. But you know, as I was praying, and my leaders, elders, advised me to return to India and serve people like me living with AIDS. So I returned to the Emmanuel Hospital Association and I worked there. There, of course, I used to operate as well
Mm-hmm.
because, I mean, many of the Western nations had certain guidelines
Mm-hmm.
prescribed I could do some procedures, surgical procedures, with low exposure, low risk of exposure to the patient. And thereafter, I returned to Ongole, my hometown, where I got a job in the antiretroviral treatment center,
Mm-hmm.
which is a unit of the National AIDS Control Organization. Of course, initially I did well in terms
Mhm.
of symptoms and disease. Thereafter, in CMC Velo, I was put on the first line drugs, HIV, antiretroviral drugs,
Mhm.
but I could not tolerate a drug called Zirovidine, which caused me profuse vomiting. I struggled for 2 years, but I could not succeed. In fact, my CD4 fell down to 27 cells per microliter, and my
Mhm.
viral load shot up to 12 lakhs per ml. At that time, the doctors in CMC told my parents, be prepared for any eventuality. And I returned to Ongole, and one of my colleagues, Dr. Chandrasekhar, he provided me the second line drugs, which were very expensive at that point of time,
Mhm.
almost 7,000 rupees a month. At that time, that was almost 10 years ago. And, but, I had the same problem. I had vomiting for 2 months. I was losing hope very steadily. But one of the verses which encouraged me in the Bible was from Jeremiah chapter 30, verse 17. I will restore health unto you and heal thee of thy wounds. I had hope in that scripture, and by God's grace, on the first day of the third month, the vomiting stopped. And I have been able to continue the second line drugs. And uh, as I mean, I have to acknowledge that these drugs, though they are very good, they have their own adverse effects.
Mhm.
And just in a casual visit to CMC Velo, my physician, Dr. Vos Abraham, ordered some tests and he detected that I had some nephrotoxicity, that is, toxicity to the kidneys.
Mhm.
And at that very moment, he did certain tests which would make me fit for another drug called abacavir, and he started me on that drug. I have been using that drug all along, and by God's grace, over the last 5 years, my viral load has been undetectable, and my CD4 count has been more than 800 cells per microliter.
Okay, okay. I mean, that's absolutely great, doctor. But with this, also, I would like to know from you, you are going through a certain treatment, certain course of treatment. So I would like to know from you, what all difficulty do you face during this treatment?
Yes, as I mentioned to you, the first difficulty was gastrointestinal. I had
Mm-hmm.
to overcome that vomiting. They would give me drugs, antiemetic drugs, but even that would not stop vomiting. The drugs are so powerful. But I thank God, there is just God's grace that the vomiting stopped. And of course, there is what is an issue called adherence to treatment, which is
Mm-hmm.
very important and vital to success in, yeah, HIV treatment.
Mm-hmm.
And of course, I have the family support. My mother, my brother's family, my sister's family. They have been with me, and they would help me. They would remind me to take drugs initially. But
Mm-hmm.
once I got on uh, to a certain point, I would adhere to drugs regularly.
Mm-hmm.
And of course, another important thing is the supply of drugs. Of course, I could afford the drugs
Mm-hmm.
privately, but NACO would supply me the drugs. And uh, I mean, so far there has not been any deficit in the supply of drugs over the last many years. And I, I I also had to face this one of the rare toxicities,
Mhm.
nephrotoxicity, and the diagnosis was subnephrotic hypophosphatemia, and it was detected incidentally. Mm. Of course, the good thing would be to undergo these tests periodically, which I ignored. But the doctor picked it up, timely, and he changed me from the drug called tenofovir and put me on another drug called abacavir. Even abacavir has a severe side effect called hypersensitivity, which is
Mhm.
almost fatal. And in CMC Velo, they do those specialized tests called HLA-B27, and it was done. I had to wait for nearly a week or 10 days for the result to come. And once it
Mhm.
was negative, I was put on abacavir. But in the situation where I have been working, we don't have facility to do those special tests. We, by faith, put the patients who have nephrotoxicity on abacavir, and by God's grace, I haven't seen
Mhm.
that adverse effect called hypersensitivity so far.
Okay. Okay. So, I mean, doctor, with you actually are explaining your journey and how you are going through the treatment and everything and all the difficulties. But I also would like to know from you a very major question. So, whoever has got infected with this disease, I would like to know from you, you yourself being a patient, what all are the necessary steps that one has to follow in their regular daily lives, um, so that they can take care of themselves in such a condition, in a better way.
Uh, I think the most important factor is good socio-economic status.
Hmm.
Unfortunately, this disease affects people of low socio-economic status. And
Hmm.
these are the people who fail to adhere to good treatment. As I mentioned, good adherence is the key to success. That's the most important thing. The second thing is disclosure to family members. And of course, I had the support of the church. I had the support of the church. And uh, that played a very major role in supporting me emotionally and spiritually. That was like a cushion.
Hmm.
I could sit back and be comfortable even while I was passing through this journey.
Hmm. Okay, okay. So these are the necessary steps that one has to follow during the course of their treatment or their disease. Okay, so doctor, these are some necessary steps that one has to follow if they are going through the course of their treatment or this disease. But now I have a very important question again. So when we talk about HIV or AIDS, so there are endless numbers of myths attached to it. So, you yourself being a patient, you must have come across people who must be believing on those myths. So now, being a patient, also being an expert of this disease, I would like to know from you, can you please help to burst out those myths that people still today believe about HIV or AIDS?
Of course, I personally believe even with HIV AIDS, we can live a normal life. Of course, I come across young couples who would like to know, I mean, young people who would like to know whether they can marry,
Hmm.
whether they can have children after marriage.
Hmm.
These are the things. Of course, there were things like the way HIV is transmitted and not transmitted, and those things have been revealed and so have been in circulation over the last many years, and people have come to terms with it. And there is a
Mm-hmm.
great sense of acceptability in the current world. I mean
Mm-hmm.
to say, the stigma and discrimination has been reduced to a great extent. But I would like the people living with AIDS to step out a little further and live normal lives. I mean, those who come to me, I would advocate them to marry. As a matter of fact, uh, one of the questions I myself faced personally was whether a HIV person could marry a HIV negative person. And my professor and my physician, Dr. O.C. Abraham, mentioned to me that if a PLHIV has undetectable viral load on two occasions over a period of 6 months, can marry a negative person. That's that's the myth that I would like to break in the population, the people PLHIV population. And the second thing is childbearing.
Mm-hmm.
Uh, you know, without any interventions, that is, without any treatment protocols, the chance of transmission, vertical transmission, that is from mother to child, is almost 30 to 40%.
Mm-hmm.
But with treatment, with interventions like treatment for the couple, as well as prophylaxis for the infant, the chance of transmission comes down to 1%. That's the success of prevention of parent to child transmission during the last 1 decade. I
Mm-hmm.
have seen that in practice in my own setting. Uh, for the last since 2011, we have been following PLHIVs, young couples, and their infants. So far, 150 to 170 infants were born in our setting, and none of them have become positive.
Mm-hmm.
So, I mean, I would like normalization of, I would like to advocate normalization of PLHIVs in the society.
Okay, okay. I mean, those are some great myths that you actually spoke about because, it's about time that we gain knowledge about these things because people in our society are still, with so much knowledge everywhere, they are still being ignorant to such small things. So, you being an expert, you actually have mentioned these great points. So, now, Dr. Joseph, one more question to you is, if a child gets HIV, if a newborn baby gets HIV from, their mother or, from their father or mother after birth. So I would like to know from you, how should the parents or the family members take care of that newborn?
Nice. Uh, of course, the way detection takes place is by doing what is called dry blood spot test. That is testing for the DNA of the baby, whether the infant is infected or not.
Mm-hmm.
And we do the test at the age of 6 weeks, 6 months, 12 months. And at the age of 18 months, we do antibody test.
Mm-hmm.
So when an infant becomes positive, we can start the infant on ART, antiretroviral treatment. Of
Mm-hmm.
course, being a small baby, we have syrups, syrup lopinavir, ritonavir, or syrup zidovudine, lamivudine. We can use those syrups to start the infant on treatment. But
Mm-hmm.
final decision will take place at the age of 18 months. When,
Mm-hmm.
because till the age of 18 months, the maternal antibodies will circulate in the fetus or the infant, in the infant, sorry. And once we make the decision at the age of 18 months, whether to continue ART or not, we can we can go ahead whether to continue the treatment or not. And they are very good drugs. Of course, the syrup lopinavir, ritonavir is very bitter to taste. So I mean, I think the scientists have circumvented that problem with what is called lopinavir ritonavir pellets. They're small capsules with tiny, 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 something like a
Mhm.
homeopathic medicine within the capsule. They can open the capsule, dissolve the medicine in the water or milk, and give the baby the medicine.
Okay, okay. So would you say that an infected newborn or an infected infant can also lead a very healthy and prosperous life?
Yes, surely, sure. As I mentioned, I have been working in Ongole since 2007. I
Mhm.
mean, they have come as 5, 6 year old children, and now they have, I mean, they led normal lives. They are leading normal lives,
Yeah.
and they are now doing graduation, post graduation. One girl recently, she has gone to the United States to do her MS in engineering.
Mhm.
And I know one boy, he got selected for medicine this year in Andhra Pradesh. And I know couples, I know, of course, a small number, but they married and they begat children as well. So there's good life. And the good news which I'm always happy about is that uh, almost 90% of people living with HIV/AIDS are long-term non-progressors. They live a long time, many of them till the age of 60 to 70 years, and they live good, productive lives. And a
Mhm.
small percent, something like 5 to 10% are rapid progressors. Whatever
Mhm.
be the intervention, they succumb and I mean, they 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 have premature death. So that's the good news.
Mhm.
A
Mhm.
majority are long-term non-progressors. They live normal lives.
I mean, that's really beautiful. And, we actually would like to let people know and educate people more and more about it. And that's a very, very beautiful thing that you shared about those students, who are
Right.
doing such great things in their career, despite of having whatever disease they are having. So, not just HIV or AIDS, but there are so many diseases that people actually have. So you should not fear death, or you should not fear a disease to live your life. You should live your life at most and in a fullest way. So with this, Dr. Joseph, I would also like to ask you one more question. So with this, Dr. Joseph, I also would like to ask you one more question, which is that you know is HIV and AIDS different? Because the ones who have knowledge about it know, but the ones who don't have much knowledge about it, normal people or general people who don't educate themselves a lot about it, don't know that there is a difference between HIV and AIDS, and they both are different. So, you being an expert, I would like to know from you, can you please explain the difference and educate people more about the difference between HIV and AIDS?
Of course, I mean, uh, for the common person or the lay person, HIV and AIDS are synonymous. You
Mm-hmm.
know, when I travel, when I travel and tell them about HIV, many people won't understand. When I say AIDS, it
Mm-hmm.
clicks.
Yeah.
They understand. But technically, uh, HIV is HIV is a general term that we use medically, but
Mm-hmm.
AIDS is a terminal stage, almost a terminal stage, and it is
Mm-hmm.
defined as where CD4 is less than 200 cells per microliter. It is defined as AIDS. It is something like a terminal condition, but as I mentioned to you, by God's grace, the terminal stage is seen less and less even as we move across the years.
Mm-hmm. Mm-hmm. Okay. So, Dr. Joseph, I would also like to know from you. So, it is not it's not important that, or it's not necessary that if you have HIV, so you must also have AIDS. If you have HIV, so doesn't necessarily mean that you have AIDS. And
Yes.
can HIV be cured?
No, it cannot be cured
Mhm,
because, even when I say undetectable virus in the blood, it is only in the bloodstream. But the
mhm,
virus hides itself in the reservoirs like lymph nodes, brain, liver, spleen, testes, or ovaries. It, the, it stays in reservoirs or sanctuaries. And if we
mhm.
stop ART, the virus will bounce back into the bloodstream and the viral load will shoot up into thousands or lakhs once again. So,
Okay.
in that, it is incurable, but it is defined as a chronic manageable disease. I still remember the impression which I had when I was reading one of the standard textbooks in medicine, Davidson's Medicine. Many years ago, I read it. The introduction was, "It is a fatal disease."
Mhm.
Now, the latest textbooks say it is a chronic manageable disease like diabetes mellitus or hypertension.
Okay, okay, oh, great. Thank you so much, Dr. Joseph Samuel, for coming to SCube TV Global and speaking with us. It was such an informative episode, and I'm so sure that our audiences must have gained so much knowledge with all that you actually informed and educated about HIV/AIDS. So, thank you again for sharing your story and your experience with us and educating us about HIV/AIDS.
Welcome and God bless you, Rajni. Thank you so much. God bless you.
Thank you so much, and God bless you too. All right, guys, that's it from SCube TV Global. Keep on watching and do subscribe to the channel.